Well, the SURVIVE study is basically addressing the question which has been asked 30 years ago, being addressed by two large Italian prospectively randomized studies comparing intensified surveillance versus standard surveillance in early breast cancer survivors. And what the Italian colleagues did 30 years ago, they did imaging like chest X-ray, liver ultrasound, but also tumor marker testing. And they actually did find asymptomatic distant metastasis earlier in the experimental arm. However, that did not lead to overall survival benefit. Now, we are convinced that obviously in 30 years there has been dramatic change in the treatment landscape of early breast cancer. So this is one reason to address this question again. And the second reason is that now we have better and much more sensitive, ultra-sensitive methods to detect persistent disease by ctDNA. And this is exactly what we do in the SURVIVE study. It's a prospective double-blind phase 3 study randomizing patients with intermediate to high-risk early breast cancer between standard of care surveillance versus intensified surveillance using liquid biopsy. And within that liquid biopsy, we look at ctDNA, conventional tumor markers, and also circulating tumor cells. Patients with any finding in peripheral blood will then undergo imaging. Patients with distant metastasis, of course, get standard of care. Patients with molecular relapse only are then candidates for treatment intervention trials. We offer 2 treatment intervention trials, the European EOTC Treat ctDNA study, randomizing elacestrant, oral SERD versus standard of care. And we also have the SURVIVE Hero study, which probably will start end of this month, in late March 2025, with first patient in, randomizing trastuzumab deruxtecan versus standard of care in patients with HER2 positive, HER2 low disease.